Having to choose a caregiving option for your loved one is a difficult decision. Not only are you trying to figure out what type of care they need, but you also have to find someone that you can trust to provide that care. If you're lucky, the senior may be able to live with a family member who can take care of their needs. But this isn't always possible or practical. Other options include assisted living facilities or in-home care, but there are pros and cons to each. While making this choice, it's important to remember that everyone is different. What works for one person may not work for another. So you have to take your loved one's individual needs and preferences into account. This means considering their personality, health concerns, lifestyle, and more. With so much to think about, it can be easy to feel overwhelmed. But by breaking down the decision-making process into smaller steps, you can make the best choice for your loved one. Let's talk about some factors to consider when choosing the right caregiver for your loved one. The first thing to consider is your loved one's needs. What type of care do they require? Do they need help with daily tasks such as bathing and dressing? Or do they need more intensive care, such as help with mobility or cognitive issues? It's also important to consider any medical needs that your loved one may have. Do they need help with medication management? Do they need wound care or other medical procedures? Once you have a good understanding of your loved one's needs, you can start to narrow down the field of caregivers. Not all caregivers are created equal. Some caregivers are better suited for certain types of care than others. For example, if your loved one needs help with mobility issues, you may want to find a caregiver who has experience working with seniors with mobility issues. If your loved one has dementia or other cognitive issues, you may want to find a caregiver who is trained in working with seniors with cognitive issues. Also important to find a caregiver who is compatible with your loved one. This means finding someone who is patient, compassionate, and understanding. Want to find someone who will treat your loved one with the dignity and respect that they deserve. Another important factor to consider is the cost of care. Depending on the level of care your loved one needs, the cost can vary widely. In-home care, for example, can be very expensive, especially if your loved one needs 24-hour care. Assisted living facilities can also be expensive, although they are typically less expensive than in-home care. When considering the cost of care, it's important to weigh the benefits of each option. Is it worth paying more for in-home care, if it means that your loved one can stay in the comfort of their own home? Or are the benefits of an assisted living facility, such as socialization and access to amenities, worth the cost? Ultimately, the decision of how much to spend on care is a personal one. There is no right or wrong answer. However, it's important to carefully consider the costs involved before making a decision. When choosing a caregiver, it's also important to consider the logistics of care. If you're considering in-home care, you need to think about things like how will the caregiver get to your loved one's home? Will they need a car? How will the caregiver handle transportation for doctor's appointments and other errands? If your loved one needs 24-hour care, you need to think about how you will arrange for breaks and vacations for the caregiver. These are just a few of the logistical questions you need to ask when choosing a caregiver. By carefully considering these questions, you can ensure that your loved one receives the care they need, while also being sensitive to the needs of the caregiver. Once you've considered all of these factors, you should have a pretty good idea of what type of care your loved one needs, and what type of caregiver would be best suited to provide that care. At this point, it's time to start looking for caregivers. If you're considering in-home care, you can start by asking friends and family for recommendations. You can also contact your local senior center or area agency on aging for help finding in-home care services. If you're considering an assisted living facility, you can start by searching online or contacting your local Alzheimer's association. As you're researching caregivers, be sure to ask lots of questions. Find out their experience working with seniors and ask for references. Once you've found a few caregivers that you're interested in, it's time to schedule interviews. During the interview, ask each caregiver the same set of questions so you can easily compare their answers. Ask about their experience, qualifications, and approach to caregiving. Be sure to ask for references and check them carefully. Once you've interviewed all of the caregivers, take some time to make a decision. Carefully consider the pros and cons of each before making a decision. Trust your instincts. If something doesn't feel right, don't ignore it. You want to find a caregiver that you feel comfortable with and who you feel confident will provide the care your loved one needs. Once you've found the right caregiver, be sure to communicate openly and honestly with them. Let them know your expectations and be clear about your loved one's needs. Also, don't be afraid to ask for help. If you or your loved one need anything, don't hesitate to reach out to the caregiver. Choosing the right caregiver for your loved one is a big decision, but it doesn't have to be overwhelming. By considering your loved one's needs, doing your research, and communicating openly, you can find the perfect caregiver for your loved one. Some people may be able to live independently for longer if they have the right support system in place. This could involve hiring a caregiver to come into the home and help with daily tasks. Or it could mean enrolling in a senior living community that offers a variety of services and amenities. There is no one-size-fits-all answer when it comes to determining when it is time to move to an assisted living facility. However, there are some signs that it may be time to start thinking about this transition. If you notice that your loved one is struggling to keep up with daily tasks, such as cooking, cleaning, or laundry, it may be time to start looking for a caregiver to come in and help out. As your loved one's needs increase, you may eventually reach a point where it's too much to handle at home. In this case, an assisted living facility can provide the 24-hour care your loved one needs. If your loved one has recently been diagnosed with a chronic illness or condition, such as dementia or Parkinson's disease, it may be helpful to move them to an assisted living facility sooner rather than later. This will give them the opportunity to receive specialized care from trained professionals. Additionally, if you live far away and aren't able to visit often, an assisted living facility can provide the socialization and companionship your loved one needs. Signs like changes in appetite or weight loss, difficulty sleeping, and increased confusion can indicate that your loved one may be struggling and could benefit from moving to an assisted living facility. Of course, every situation is unique. The best way to determine when it's time to move is to have an honest conversation with your loved one and their doctor. There are many different types of caregivers and caregiving options available, so it's important to do your research and find what works best for you and your loved one. The following are just a few examples of the many caregiving options that are available. In-home care, this involves hiring someone to come into your loved one's home and provide assistance with daily tasks. This could be a private caregiver, such as a family member or friend, or a professional caregiver through an agency. Assisted living facilities. These facilities offer a variety of services and amenities, including housing, meals, transportation, and personal care. Memory care. This type of care is specifically designed for people with dementia or other cognitive impairments. It may be provided in a dedicated memory care unit within an assisted living facility or in a standalone memory care facility. Respite care. This is short-term care that gives caregivers a break. It may be provided in a variety of settings, including assisted living facilities, nursing homes, and adult daycare centers. Adult daycare. This provides daytime care for seniors who need supervision and assistance. It may be a good option for seniors who live at home but need some support during the day. When choosing a caregiving option, it's important to consider your loved one's needs, budget, and preferences. There is no one-size-fits-all answer, so it's important to do your research and explore all of the options available to you. As you begin your search for a caregiving option, here are a few tips to help you get started. Reach out to your local area agency on aging or senior center for information and resources. Talk to other family members, friends, or neighbors who have experience with caregiving. Get input from your loved one's doctor or other healthcare providers. And don't be afraid to ask for help from professionals such as geriatric care managers or social workers. Remember, you don't have to go through this alone. There are resources available to help you find the right caregiving option for your loved one. We hope you enjoyed this video, and we hope it has helped you understand the different caregiving options available to you. If you have any questions or comments, please feel free to leave them below. We would love to hear from you. Thank you for watching.